Hey, my name is Taylor. I'll be your nurse today. Could you please verify your name and date of birth?
Jacqueline Jones, 1214.
Alright, we're going to be doing an intramuscular injection in your right deltoid. Now let me just wash my hands and give you some privacy. Close the door. Alright, for the intramuscular injections, the first one is the right, or the deltoid, and you put your non-dominant hand on the acromion process and you inject it into the muscle. Your next one will be, you will draw a line right here, and you'll have like that, like a square like that, and you do it right in the middle. And then for your next two, you would put your right palm on the greater trochanter of the femur, and then your tip of your finger on the iliac crest of the hip, and the right here it would be the ventrogluteal muscle, and this would be the dorsogluteal muscle. And then for your subcutaneous injection sites, your first one is right here in the fat on the arm. Your second one would be, if you turn around, the upper middle part of your back in this area, and then the lower middle part of your back, the upper buttocks region in the fat right there. And then you do, if you'll turn around, face the camera, you'll do the abdomen region. It has to be at least 2 finger length or width from the umbilicus. And then you have the front of the thigh is your last subcutaneous injection. Alright, thank you. Okay. So my physician's order says draw 1.4 milliliters of solution from a vial and administer IM, which is intramuscular. What we're going to do first is we're going to take the syringe. I'm going to get the one with the inch-long needle since it's intramuscular. I'm going to safely take the cap off. And since it's a vial, I'm going to inject 1.4 milliliters of air. And take out 1.4 milliliters of solution. And I'm going to get my air bubbles out. And that's on 1.4 milliliters. With the top ring where it says. Alright, I'm going to safely cap the needle, and on the solution I want to make sure it's the right solution, and I check the expiration date. Alright. Now next what I'm going to do is put my gloves on. Alright, I'm going to be doing the intramuscular injection in the right deltoid. So what I would do is normally not have a rip in my glove. I would put my non-dominant hand, well first I would, with the needle still capped, I would put my non-dominant hand right here, and I would rub in a circular motion with my hand on non-dominant hand on the acromion process, and then I would inject it with at a 90-degree angle and then I would inject it and apply pressure. Alright, and then I will put that in the sharks container, and then I will take my gloves off, perform hand hygiene, and document that I injected 1.4 milliliters of solution via IM, and my initials are right there.
Yeah.